We are the faces of Black Maternal Health. My name is Dr. Bola Sogade. I'm a board-certified obstetrician, gynecologist, a family physician, a minimally invasive robotic gynecologic surgeon, the founder of the first freestanding birthing center that is physician-led in the state of Georgia, and the host of a public podcast called Cocoa Pods. I'm here to talk about what minority women face when it comes to maternal and maternity health. Minority women experience more complications during pregnancy and childbirth, and a lot of the complications can be seen to be due to patient factors, physician factors, and factors in the system. Some of the patients do not have access to healthcare. Some of the patients do not have access to the things that will make their health before pregnancy better, like good nutrition, the opportunity to exercise, the opportunity to de-stress, the opportunity to have underlying conditions diagnosed and managed before pregnancy. And during pregnancy, some of the patients do not have the ability to attend regular prenatal care. This is important because issues like elevated blood pressure, abnormal sugar levels, and even stress can be diagnosed and managed by attending prenatal visits regularly. And at the level of the providers, there are not a lot of race-congruent providers that provide health care to minority women. Also, some of the providers are not attentive to the complaints of the women. That is, at times they are dismissive. And at the level of the systems, when the patients eventually make it to the hospitals, a lot of them have to travel from far places because they live in rural America. When they eventually make it to the hospitals, they are not treated like their white counterparts. So I want to use this opportunity to educate Black women in that seek care for yourselves when you are pregnant. Find a physician that is board certified and listens to you. And make sure when you get into the hospital systems, you go with family members that can speak up for you when you are not able to do so.
I am Dr. Felix Sogade. I'm a board-certified cardiologist and electrophysiologist, but more importantly, I'm a father of 2 daughters, husband to a beautiful obstetrician gynecologist, and we also have a son. And we believe that as a family, we have worked tirelessly together, advancing the cause of maternal health in general, but more specifically, centering around minority women. We run a practice here in Georgia called Georgia Arrhythmia Consultants, and we also lead a community effort called Georgia Arrhythmia Foundation to raise awareness about issues relating to sudden death, especially as it relates to a minority population where access to emergency services is more limited, and also the knowledge and know-how on how to do basic life resuscitating efforts sometimes can be limited. So we've led a campaign to raise awareness and train people in performing some of these services. But as it relates to my Black maternal health, from my perspective as a cardiologist, some of the issues that I've seen is a question of early diagnosis. How do the women get screened for conditions such as hypertension, excessive body weight or obesity, or diabetes or metabolic syndrome, some of the conditions that can impact ultimate outcome in pregnancy. Sometimes some of the patients are not aware of these conditions till they get pregnant. And I have noticed in our practice that this lack of access and early screening ultimately impacts outcome for women in pregnancy, because there are some conditions you want to take care of before the woman gets pregnant. And the opportunity to do that sometimes does not present itself. And so we need a broad-based effort to educate women things to watch out for. As a young woman entering reproductive age, you should know your blood pressure. You should know some of your basic metabolic profiles. You should know your hemoglobin A1C. You should exercise regularly to maintain an ideal body weight as best as you can. And issues as psychosocial stress is also very important. Efforts to build a team around yourself to reduce psychosocial stress. Support systems are very important. And we can basically look at many of the other things that can be done to really help people is to have a broad-based access in a system whereby access to insurance products, good nutrition, and facilities for recreation is very important. Thank you.
We are the faces of Black maternal health.